their initial symptomatology. The issue of infectivity is where we use that 10-day mark from the initial positive test, assuming the patient has no fever, etc.
During his interview, or whatever it was, with Sean Hannity last night, President Trump repeatedly paused and coughed. Take a listen.
Oh, and I think the first debate, excuse me, on the first debate, they oscillated the mic. Well, I want him to vote, but I will say this, absentee is okay, because absentee ballots, excuse me, absentee ballots are fine.
He was asked about this today, and he said it's just a, quote, lingering thing. Sounds to me like he still has symptoms.
Yeah, I mean, you can have a viral infection and then have persistent cough and other feel good. I mean, this is really something that, a physician has to pay really close attention to and say, is this just a little bit of a hack that's hanging around, after the patient has otherwise fully recovered? Or is this really still, an active inflammatory process in the lungs that you really don't want to put too much stress on?
If somebody came to you based on what you know and what you don't know, and let's be frank here, the White House has been opaque about the president's illness. They've lied about it. They've refused to answer questions about it. There's basic medical information we do not know. If somebody came to you and said, sir, I'm a Navy aviator and I'm supposed to fly Marine One and take President Trump to Pennsylvania, is that okay for me to do? Or somebody said to you, I want to go to that rally in Pennsylvania. It's indoor. It's an indoor rally. What would you tell either one of them?
Well, I would tell you right now, so let's take somebody who's going to come back and take care of patients in a hospital. If it doesn't matter if it's 10 days, 14 days, 21 days, if those folks are still symptomatic, we're not bringing them back to work at all. I mean, if they tell us that they're symptomatic, if their physician is advising against it, then we keep those folks out of work until they're symptom-free. Just simply because we know with this illness that symptoms can persist for a long time, and there can be, distant complications from COVID that you really want to keep an eye on and you really want to avoid if you can.
Dr. Daniel Varga, thank you so much. Really appreciate your